And helping present with me today is going to be Eric Gold. He's with Teladoc. He's been with them for, I think going on 12 years now. Eric, can you hear me okay?
Yeah, I can hear you fine.
So from a housekeeping perspective, we tried scheduling this meeting last week. We had some difficulty there. We could see everyone signing in, but we could not sign in as hosts. We kept getting a busy signal. And so with our IT division trying to help us, we quickly determined that the lines were so bogged down that we couldn't host. And so we had to reschedule this. And so I appreciate you hanging in there with us. We're all going through a lot right now. Our goal with this presentation originally was to have it for an hour, but I realize all of us are very busy, so be respectful of your time. We condensed the presentation. It's going to be between 25 to 30 minutes. During the presentation, if there's any questions, we've decided to mute the line. We have, I think at this point, over 50 attendees, and we just thought rather than over-talking each other, it would just be easier to send an email in. So feel free to send an email to your account executive or to me direct, which is bill.heidt, that's HEIDT, at BRMSonline.com. From a topic perspective, our goal today is to kind of highlight what is telemedicine, right? Why is it so popular? What is it? Why is it in the media so much? What is it different from what's in your current health plan? And of course, we'll go through some pricing. If there's any specific questions you have, again, we'll probably be following up to each one of you to answer any direct questions. To highlight why this is important from a BRMS perspective, as your third-party administrator, we manage a little over 600,000 employee lives. And on a daily basis, we can't even tell you how many phone calls we're receiving into our center on a daily basis, both from employers and by employees, asking about whether or not they have this service, and if they do, how does it work? What are the features and benefits? Walk us through it. To put in perspective, I mean, many of our primary care physician offices are closed. And so as employees that go out looking for help, again, their offices are closed, forcing people to go to ERs and urgent cares, which, of course, at this time, staff is limited, and so the wait times are increasing. And more than that, many of us, because of stay at home, we just quite frankly don't want to leave our homes, although we still might need to get help. And so, again, as we were kind of planning this meeting, there's an interesting story that came in-house. And so I thought I just might share with everyone before we hand it over to Eric. And that is about 2 weeks ago, there was a gal that called into the office, and her young child, who I think was around 5 years old, was having some asthma conditions. And that's just kind of common here in California as the trees and flowers start to bloom. And so she was trying to place a phone call into her doctor's office and was not getting a response back. And so she was forced then to go into the ER. And as she checked in the ER, they gave her a 5-hour wait time. Not only that, she was concerned that her daughter, that if someone was infected with the COVID-19 that already having an issue with her lungs, that this could be fatal to her daughter. So while sitting in the waiting room with a mask on, she opened up her wallet and found the BRMS card. She called into our center here. And within minutes, the person on the phone was able to help direct her that, in fact, her company did have this telemedicine option. And through Teladoc, they're able to connect her with a primary care physician over the phone. They were able to treat the condition. Within 15 minutes after the phone call, medications were called into the pharmacist in the local area. And so, this is just a success story of many that we hear on a daily basis, just kind of driving home the fact that this is important. Not only that, what we try to do as your third-party administrator is have our account executives give ideas and strategies like this on your renewal. But because of the pandemic, because of the price savings that we're seeing, this is not something we wanted to wait until renewal that happens in July or a renewal that happens in December. Our goal with this is to reach out to our clients now and saying, hey, we didn't want to wait. We're seeing this as helpful to clients, and because of that, this is not something we want to sit on. So as we go through this, Eric's going to kind of talk through what is telehealth. He's going to hand it back over to me. We'll go through a case study. The case study is actually based upon BRMS, and we'll talk about next steps. So thank you again, and Eric, take it away.
I appreciate it. Thanks, Bill. Can everybody hear me? Can you hear me okay?
Sure can.
And can you see my screen okay?
Yes.
Perfect. So welcome, everybody. Thanks for taking the time today. I know I'm sure you're very busy. I know we're slammed as a company, and we're it's crazy times right now, but we're here. What Bill and BRMS are talking about providing a solution that can hopefully help out everybody on this call today. I'm going to go to today's call. I'm going to really kind of start from the basics and talk about what is telehealth, the advantages of Teladoc, some additional solutions and services that we have, and then I'll turn it back over to Bill to get into some case studies on how to get started. But for today, I'm really going to kind of look at it through all your eyes. That I would assume that everyone on the call is a human resources director or some kind of capacity within your department. I'm going to assume that everyone, if not everyone or most people on this call, have some type of self-funded plan. But you're also looking for answers and solutions right now. And what I'm going to talk to you today about is with telehealth and Teladoc specifically is just a much more cost-effective, much more convenient, and just a much more it's just a much easier way to access healthcare in a clean, fast environment. So I'm going to talk about virtual care and what it means kind of in a little bit, but let's talk about Teladoc as a whole. So if you haven't heard of Teladoc or you're not familiar with Teladoc, we've been in business now for 15 years. I've been in telemedicine now for over 12 years myself, but we've seen it grow tremendously. It's an amazing story. Teladoc is the granddaddy of them all. We still have over 70% market share. Worldwide now, we're in 130 countries. I think last count we had 56 million employee lives under with our services. As you can imagine, the reason why you're all on this call and why it's an exciting topic is I'm sure you've seen President Trump on the podium talking about telehealth almost on a daily basis, because it is such a powerful solution to offer people, not remotely, but also just in a much more cost-effective and convenient manner. So because of that, just in the last few weeks, I think we've added around like 4 million new employee lives on our platform. It's crazy. It's going fast, but we can support it, and we are more capable of taking on more lives. We've prepared for this for years for instances like this. So Teladoc's publicly traded. We're about $11 billion company, 3,100 employees worldwide, 450 subspecialties in medical. This is a crazy number. So last year alone, we did over 4 million telehealth consultations. We are scaled, and we're darn good at what we do. And with that, even with the influx of coronavirus, that number is going to probably double this year. We've gone over 200% of our average calls. Just the other day, in the height of 2019, we did about 10,000 consultations a day. We've already hit over 20,000 consults a day. It's pretty crazy, but our staff's keeping up, and we're still keeping average callback time under 20 minutes. So pretty powerful solution. So let's talk a little about virtual care and virtual, what I mean by that and why it's so important. So when I talk about virtual care or virtual first, it's really, if you think about anytime somebody needs to step in to see a doctor, whether it's primary care, urgent care, emergency room, any kind of subspecialty, what we're doing from a virtual perspective is we want to be able to handle as many of those types of instances when somebody needs to see a doctor in person. We want to take care of that on a virtual platform. So that could be picking up the telephone and calling. It could be a video consultation, an email, over on your web, on a mobile app, even texting in some instances. But we want to take as many of those instances as possible. So it's all built into what we do. And this isn't a term that we came up with. This was a phrase that was coined by some of the biggest consultants and biggest companies in the world, the Fortune 1000 companies, that it was estimated in 2019 that over 78% of Fortune 1000 companies were going to implement some type of virtual care solution. So this isn't something we Teladoc coined or invented, but we're taking it to the entirely different level of providing those types of solutions. So what I mean by that is when you think of, if you look at kind of, I love this slide because it kind of paints the picture of what we're talking about. Everyone on the call today, I'm assuming that you don't have some type of telehealth solution, or if you have, you're looking at options or different types of solutions. We call that general medical. So if you think about like Teladoc, the core service, what we're famous for and what will never go away is our general medical, we call it Gen Med service. But basically, that's a primary care physician. The member can call us up 24 hours a day, 7 days a week. We guarantee that physician will call them back within an hour. Like I mentioned, average callback time right now is about under 20 minutes. But in 94% of the cases, that doctor is able to diagnose over the telephone, and if necessary, phone in a prescription to any pharmacy that they like. They're all so I'm going to make the assumption that a lot of you aren't familiar with kind of the down and dirty of telemedicine in general. So kind of some of the big glaring questions. All U.S.-based licensed physicians, all board certified. They average about 20 years of in practice, and our physician network has grown tremendously. I think just in the last few weeks we've added over 3,000 physicians to our network just to handle the call volume. With that being said, extremely high clinical quality goes on behind the scenes. The kind of I don't want to spend too much time, but I could spend an hour just on clinical quality that we require in terms of chart reviews, in terms of e-scripts, and making sure our doctors aren't overprescribing medication. Just be it known that the type of clinical quality that our physicians offer on a daily basis is actually better than going into a brick and mortar type of setting. It's pretty crazy, but just know that your members, your employees, and their dependents will get the top service. It's not watered down by any means. So that's general medical. What we've done over the years, and we've asked for it, we've heard it asked for. You've seen it. Some of the slides that showed you with the consultants have asked for this. We've added on a suite of different types of doctors and services to this. So it's not just general medical now. Everything I'm showing you here on this screen is whether it's just episodic, low complexity up to high complexity, is live on the Teladoc platform. So we have pediatricians on our network, we have dermatologists, we have behavioral health specialists, and then you get into our expert second opinion. What we really want to focus on today is general medicine, Gen Med, the dermatology, and the behavioral health. I think those are kind of the best starter package, if you will, to get your employees up and running. So let's get into that. So if you look at what does this mean to your health plan, this is one of the only services I know of out there that by spending money, you're actually going to make more money on the backside, saving your plan from an ROI perspective. We were asked for years, okay, what does it really mean if somebody uses a Teladoc platform and we keep them from going in to see a physician? What does that mean to the medical savings on the major medical plan? So we had an independent study conducted a couple years ago. They took about 3 million of our employee lives, crunched the numbers, and what they came up with was that every time that somebody was able to come in and redirect that claim and keep it off the major med, we took care of it. On average, we saved that plan $517. This is so if you kind of think about this in rural, what does that mean? If you kind of look at a blended rate, we ask every member that comes in, we actually ask them, what would you have done? Would you have gone to primary care? Would you have gone to urgent care? Or would you have gone to the emergency room? Or would you have done nothing at all? And if you look at kind of the blended rate between those, it's about $517. So that's everything that we put together in terms of our ROI, and it's built into our utilization report. So you can actually, and I think Bill's going to share an example of that in a little bit as well too. So everything's all integrated into our app and into the user experience. So whether a member calls in directly to our call center or actually goes through the app, we're going to find the type of physician and the type of service that they're looking for. So today, like I mentioned, we're going to focus on Gen Med, pediatrics built into that, behavioral health, and dermatology are the services we're going to talk about today. So it's all built into the app. It's all modular based. So artificial intelligence, native language are all built into the app. So when somebody comes in, we're going to find out exactly what condition that we're dealing with and then get them off to the appropriate doctor. So if we get them to a general medical doctor, this is what it looks like. So you can access it by going on the web, just picking up the phone, or we have an award-winning mobile app as well too. that over 60% of our consults are actually generated from the app now. So like I mentioned, extremely high clinical qualities, very stringent standards. This number has more than doubled in the last month or so with our physicians. We have a lot of physicians that are kind of on the bench that want to get on the network, but we haven't put them on up until now because we wanted to make sure our doctors were getting enough consults to keep them happy. Now they are. And then, like I mentioned, $517 savings per visit. And I'll show the last slide is we have over 5 times the utilization of the industry standard just because we advertise and we push it so hard. So GenMed, like I mentioned, 92% of the visits are resolved on the first time, $517 per claim visit, and member satisfaction is through the roof. These are this is a good kind of starting point for conditions that are treated through our network. Suffice to say that over 77% of the time that somebody needs to see a doctor in person, we can handle it via our telehealth services. And if you look at the top 9 conditions why people actually go to the emergency room, we actually handle every 9 of those, all 9 of those via telehealth, no problem. So pretty easy. Member initiates the consult. We start the request. Usually it's immediately, they want to talk to a doctor immediately. We make sure that the member's information is in the system, all their medical records are up to date, and then we initiate the call, and the doctor, we say, watch for the call, 800 number, and the doctor will call them back, like I mentioned, usually within 20 minutes now. And if prescription is needed, there's a fallback pharmacy that the member provides, or if they're traveling, we'll find a location that they want that prescription sent to via e-scripts, all electronically. So that's general medical. The next service that is very powerful, very timely in today's world, where people are stressed and they're shut in, they can't get out, and they're worried, and a lot of behavioral health issues going on right now. We have a solution that's extremely affordable and very powerful too. So behavioral health, where our general med is not actually meant to replace doctors, we're meant to complement them. This service is absolutely meant to replace behavioral health specialists, and there's a big reason for that. There's a shortage of behavioral health specialists. A lot of behavioral health specialists, psychiatrists, psychologists are not even taking insurance anymore, so it's all cash-based. And there's a long wait time even to get in to see one. In rural areas, forget about it. Virtually impossible to find a behavioral health specialist. And then you have the stigma attached of actually maybe being seen going into a behavioral health specialist's office. So many people just avoid it altogether. So now we have a solution. This is ongoing counseling. We offer board-certified psychiatrists and psychologists that the member can go as often as they want, and it's all done. You can just pick up the phone and call, or you can do video consultations, and we just charge the member. Very low PEPM for the employer on this, and then the member pays, and you can actually set the copays differently, so you can share a portion of this if you want. But a consultation with a therapist or a psychologist is $85 a visit. For a psychiatrist, the initial evaluation is $200, and then ongoing sessions are $95. The big difference between the two is the psychiatrist can actually diagnose and prescribe medication over the telephone if necessary. So that's the behavioral health. And dermatology is pretty straightforward. It's a zero. We can add this free of charge on top of the general med, and then the member pays a $75 consult fee for a dermatologist. Basically, you upload up to 3 images. The licensed dermatologist will review them and then get back to you within 48 hours with the diagnosis. So pretty straightforward, easy to do, and you're off and running. Caregiving is something that's automatically included with our general med, but it's a pretty powerful service, especially in today's world. This is no matter what type of plan your member's on, caregiving is included. So basically, for their parents or their parents-in-laws, they can do a 3-way call, and then they're just paying a $45 consult fee for that member. So even though their parents aren't part of their overall major med, they're part of ours, and that's another great point. our plans cover the entire family. So even if you have employee only, then maybe a spouse has their spouse is on their own employee's plan, or the kids aren't covered, they're covered with us. So even in the zero consultation plans, every single dependent is covered with us as well too. So that's caregiving. So I'm going to turn it back over to Bill now, and you can get into what that means and with BRMS, some case studies, and how to actually act on this. So Bill, go right ahead.
Okay. Let me see if I can. I'm not sure if it's going to be able to allow me to hand it over.
I can. That's okay. I'll just go from screen to screen. Go ahead.
Great, wonderful. So I wanted to include a case study, and the case study is important because I wanted to show the group what we're doing here at BRMS. It's kind of the concept of put your money where your mouth is. So we've introduced this into our platform here at BRMS about a year ago, and the graph at the bottom there highlights a kind of a linear line there in light blue, and that represents utilization each month. So historically, we've trended around a 15% utilization, and to put some color around that, we have about 215 employees here at BRMS. So if we look just in the month of January of this year, which is the only data point that I could use to kind of compare the two, and that's because Teladoc is lagging about 50 days in the rear with the information they provide to us. But in the month of January, we increased our utilization to almost 30%. And what that means in terms of savings to our health plan is around $31,000. Now that's important because, you know, in these times, again, where our clients' doctors are not open and they're being forced to go to the ER, an average ER visit, you know, I was discussing with my team, averages between on the low end $1,600, and more frequently we see plans cost, you know, if we were just to go in just to get a checkup, it's about $6,000. And so that can cause a dramatic increase into a self-insured cost plan. And so again, this is just one indicator to us that this is working. So if we were to kind of take that same data point of savings in the 1 month of January, our plan alone is going to save upwards of, you know, $300 and probably close to $400,000 this year, possibly higher than that because of the pandemic. If you go to the next slide, please. So, you know, why partnership with BRMS on this? You know, as your third-party administrator, you know, we can set this up quickly. You know, there's been, again, on a daily basis, we're getting an influx of calls about people wanting to implement quickly. We can have this set up if this is of interest to you within 7 to 10 business days. What's also nice is the ease of doing it. So we can basically add the cost of the bill within your consolidated bill like we normally do. So again, as you pay BRMS, we can go ahead and pay the vendors from which you utilize. Bullet point 3 is you know, sharing the information with BRMS. We can understand the utilization in your plan like we do on the other data points that we get for your plan. So we understand, hey, what are people being seen for? What are other cost containment strategies we can introduce into the program to help mitigate risk? But there's just another touch point that we have here at BRMS to help kind of understand your plan. And of course, the last bullet point is communication. So, you know, a plan like this, like Teladoc, is only powerful to the extent you can have people understand it and utilize it. So Teladoc does a wonderful job of marketing to their clientele, but we can also piggyback off that and help market that as well. And so there are cards that are sent out to the employee base. There are things that we can put on into our VBAS system. And other resources that we can do to help deploy this out to the employee base, again, to help increase utilization. Next slide. As we look at cost, there are 2 options. What I wanted to do is we put the BRMS pricing is kind of, again, shows what we call street level pricing. The benefit to the group here is, you have 2 options. The first option is $1.25 per employee per month. That does come with a $45 consult fee. That consult fee can be divided up in any percentage amount that you like in between the employer and the employee. So for example, if you like that option, you know, the company could say, you know, we'll assume 50% of that consult fee, and the employee can assume the remaining 50%. And the other pricing option we have is an all-in $2.25 fee, and there is no consult fees associated to that. The interesting part about the $2.25 one is that that could also include the dependents, and there is no additional cost for that. So for example, we're working with a client out in Hawaii. She had this, her husband was on a different health plan. The husband became ill with a cold. Even though he wasn't on her plan, he was able to call in, pay no deductible or co-insurance for this, and he got treatment and medication called in at no cost. Again, as it relates to pricing, what I find most advantageous here is you can fall underneath the BRMS block of business. In order for you to get relative pricing like this would mean that you'd have to have upwards of 10,000 employees or more in order to get this reduced pricing. So, you know, we feel strongly again about what this means. As it relates to BRMS, what we like about it too is that, you know, we also have this $2.25 fee. So if we have 215 employees, we pay about $483 a month. And the way that we look at that is to the extent we have one person who utilizes a Teladoc system versus going into the ER and more than pays for the entire service for our entire company. And again, just in January, we had over 35 people utilize Teladoc, saving us over $31,000. So for us, it's a small out-of-pocket expense to save a huge amount of money over the entire year. And we expect, because we have this service implemented into our system, that, and because of the pandemic, that our savings in our plan is probably going to be a heck of a lot higher than what we're projecting. So that kind of gets us towards the conclusion of the call. We're probably just at the mark of you know, we're a little over here. And so I want to thank everyone for their time. As it relates to next steps, what I'd like to do is I'll email each one of you who's participating on the call today, ask or answer any questions you might have. If this is something that you'd like to start right away, just go ahead and email us. Again, there's no forms to sign. There are no contracts to sign right now. And again, we can probably have this set up within 7 to 10 business days. So with that, thank you again for your time. We appreciate it. Everyone stay safe and have a happy Easter. Thank you.